Hello everyone. Our lecture is about the contents of the pelvic cavity. Part 1. Sigmoid colon and rectum. Sigmoid colon. This sigmoid colon located in the pelvic cavity as a continuation of the descending colon. The length of this colon is 25 centimeters and in some persons reach to the 38 centimeters. It's mobile, so it needs two holes in this position. So there are mesentery that called sigmoid mesocolon holds the sigmoid colon in this position. This sigmoid colon that is considered mobile structure located in the intraperitoneal. Relations of the sigmoid colon. In the male, anteriorly urinary bladder, while in the female, uterus and vagina. Posteriorly, same in both sexes. Sacrum with rectum in male and female. The blood supply of the sigmoid colon is sigmoid branches from the inferior mesenteric artery. Lymphatic drainage of this, it drains into the inferior mesenteric nodes. Also the venous drainage into the inferior mesenteric vein. Rectum. This structure that begins as a continuation of the sigmoid colon located in the pelvic cavity with length 13 centimeters pierces the pelvic diaphragm and continues as the anal canal. The first part of the rectum is intraperitoneal structure, while the second part and last part of the rectum is considered retro or extraperitoneal. Relations of the rectum. Posterior to the rectum, there are piriformis muscle and coccygeus muscle, sacrum with coccyx below this muscle, and sacral plexus and sympathetic trunk. So this structure is located posteriorly. Anteriorly, there are sigmoid colon and coils of the ileum, and this in both sexes, male and female. But when we descending with the rectum, the structure is different. So in the male, in front to the rectum, there are seminal vesicle with vas deferens, also urinary bladder and the rectopubic pouch. So these structures, in addition to the prostate located anterior to the rectum, and this absence in the female. So what the structures in the female in front to the rectum? In the female, there are rectouterine pouch here located anteriorly with vagina, in addition to the coils of the ileum and sigmoid colon. The blood supply of the rectum is from superior rectal artery that considered terminal branch of the inferior mesenteric artery, provide blood supply to the mucosa of the rectum, and the middle rectal artery that also provide blood supply to the muscular coat, and inferior rectal artery. The inferior rectal artery is a branch of the internal pudendal artery and also provide blood supply to the lower part of the rectum. The superior rectal artery anastomosis with the middle and inferior rectal artery. The venous drainage of the rectum is superior rectal vein that drains into inferior mesenteric vein, middle rectal vein that drains into the internal iliac vein, and inferior rectal vein that drains into the internal pudendal vein, then from the internal pudendal vein to the internal iliac vein. Nerve supply of the rectum is hypogastric plexus. Inferior hypogastric plexus. The nerve supply of the rectum is inferior hypogastric plexus that located on either side of the rectum. Also provide nerve supply to the sigmoid colon. Thank you for listening.